Okay, so this presentation will be covering the article titled Mindfulness-based stress reduction for patients with anxiety disorders, evaluation in a randomized controlled trial. The authors of this article are John Vollestad, Borg Silverstein, and Geir Hostmark Nielsen. My name is Christy Jarrard, and I'll be the one who's presenting this to you. All right, so over the course of this presentation, we're going to be kind of covering some of the background information about, where research is at with anxiety and mindfulness, and then we're going to go into the methodology of this study and specifically, what was being compared and what classification of participants were involved, and then we're going to talk some about the results and the discussion, and then the implications and future direction, and I'm going to save that good stuff for later, so... The background information. So currently there's a focus on treating anxiety with MBIs, which are mindfulness-based interventions. And this idea was kind of thought up because they wanted to facilitate a less reactive relationship with negative experiences and thoughts. And mindfulness exercises allow opportunities for desensitization and exposure to internal events, which, kind of allows people to have a different perspective on their distressing experience. Mindfulness is specifically defined as paying attention in a particular way on purpose in the present moment with acceptance, and Kabat-Zinn, who is the creator of MBSR, is the person who provided that definition, and that's what's used throughout all MBIs. Specifically, there have been multiple clinical trials involving MBIs that prove a substantial reduction in anxiety severity and comorbid symptomology, and comorbid with anxiety is commonly depression, and anxiety is also comorbid with a lot of other diseases like multiple sclerosis and chronic diseases of various sorts. Additionally, there was a meta-analysis that found a large within-group effect sizes when MBIs are employed on clinical groups with anxiety symptoms, and basically this just means that MBIs show a large effect when they're given to clinical patients that have anxiety symptoms. So, yeah, okay. Hypotheses. All right, so Vollestad, Silverstein, and Nielsen aimed to determine the potential of MBSR as treatment for patients with diagnosed anxiety disorders. Now, specifically, they wanted to look at the effects of MBSR on patients with panic disorder with or without agoraphobia, social anxiety disorder, and generalized anxiety disorder. Now, they didn't really make any predictions about this, but it is safe to assume that the researchers anticipated a reduction in anxiety symptoms across the board, seeing that everything that was listed in their introduction was about the successful uses of MBIs to treat anxiety. They also made an additional hypothesis that predicted that self-reported trait mindfulness would act as a statistical mediator of any effects on anxiety, worry, and depression. And that was pretty interesting. It basically means that the more people are reporting that they are more mindful, the lower their worry and anxiety and depression will be. Okay, so in order to measure this, they recruited participants through a newspaper advertisement, specifically soliciting individuals who experience anxiety and are willing to be in a clinical trial for a novel anxiety treatment. And in order for participants to be eligible, they had to be between the ages of 18 and 65, and they had to fulfill the requirement for either panic disorder with or without agoraphobia, social anxiety disorder, or generalized anxiety disorder, and these assessments were determined using the MINI scale, the Norwegian version of the MINI. Now, in terms of participants, they were about 2/3 female, which isn't that great evenly, but that's all right. And this schematic down here at the bottom shows you that there was, a total of 76 participants, and they tried to evenly split that up between the waitlist condition and the MBSR using a randomized program. And you can tell with the numbers of the disorders that they tried to evenly distribute the diagnostic distribution. Oh, that's okay. All right. Now, this experiment is a between subjects design, so this means that participants were either placed into the MBSR condition or the waitlist control. All right, so in order to record the changes in anxiety and depression, they used several report measures such as the Beck Anxiety Inventory, the Penn State Worry Questionnaire, the Spielberg State Trait Anxiety Inventory. I'm sure you can maybe you could read those. All right, so they use several measures. They use 8 total, from like anxiety measures to worry measures to anxiety inventory, anxiety trait, Beck depression, the symptom checklist, and then an insomnia scale. And in order to measure that second hypothesis, they included this 5-factor mindfulness questionnaire. And then another material that was involved is that participants had to keep a log to ensure that they were practicing, and the researchers used this log to verify that patients were participating to the expected amount. All right, so in general, patients, we already kind of talked about this, that patients were randomly assigned into either MBSR or waitlist control, and the MBSR that was utilized in this specific study was following the protocol that Kabat-Zinn developed. And that includes it's 8 weekly 2.5-hour sessions. It's a half-day meditation retreat during week 6, and daily home practice. And they provided guided meditation CDs to keep that consistent amongst the participants. And then keeping up a log. And then these are the 3 main components that were involved in each session and involved in the home practice. So this is like the teaching material that they covered, the concept of mindfulness, psychology, physiology of stress, anxiety, and then how to incorporate mindfulness into everyday life. Specifically, the exercises that they utilized were the body scan, sitting meditation with awareness of breath, and mindful movement. And it's important to note that discussion and sharing is like vital in MBSR, and all participants were expected to participate in this discussion sharing aspect in both pairs and in large group. And so while all of this was going on, the self-report measures, the 8 listed on the previous slide, were given out to the participants to be completed at baseline, at the start of treatment, during week 4, post-treatment, and then 6 months after treatment for the follow-up. So both participants in the waitlist control, who received no treatment, and the participants in the MBSR were filling this out during that first 8-week covering period. Okay, so for the results, so these are the averages for the people in the MBSR group on each separate index, and then these are the averages for the people in the waitlist control during that period where they didn't receive any treatment. So the significant results, there was a significant reduction in anxiety and or depression scores in every index. You can see that the numbers drop significantly, and they look at this ES within value, which kind of indicates the level of change, the magnitude of change. Okay, and so they used an ANCOVA, which is an analysis of covariance. Additionally, they went ahead and looked at clinical significance using this method described by previous researchers, and basically they looked at the Beck's indexes and looked at the values in accordance with what would be considered a full recovery and what would be considered a reliable improvement, and what ranges were associated with that. So using that calculation, they determined that approximately 67% of the participants in the MBSR condition benefited, while about 33% remained unchanged. But unchanged doesn't mean that they didn't necessarily get any improvement. It just meant that it wasn't significant enough to be considered a reliable improvement or a clinical significance by these other people's calculations. All right, so like I said, all scores decreased except for the mindfulness questionnaire, which increased, indicating more mindfulness post-treatment. And so they did find a mediating effect of mindfulness. However, they anticipated for this mediating effect to be seen at about during the midway assessment and kind of precede the decreases in anxiety and depression, but instead they saw mindfulness significantly change by the post-treatment assessment, comparing pre to post rather than pre to mid. And this made them more tentative with their conclusion, and they still think that more research should be done to determine this. And they found the strongest mediating effect was for the Beck's, or that anxiety index. There was a partial for worry and trait, and it was completely absent for the Beck depression inventory. So these findings really mean that mindfulness training has beneficial effects on anxiety disorders and related symptomology. So it is important to note that, what is novel about this research? Okay, so findings indicate that mindfulness training has beneficial effects on anxiety disorders and related symptomology. It is important to note that, why am I just reading it? Whatever. Indicate mindfulness. And so that's really good to know. And also they found within the study, they did that insomnia self-report, and they found that mindfulness also reduces that. So they thought that it might even be, that mindfulness could be beneficial to counteract sleep problems, particularly in line with other research. The study found a significant reduction of worry, showing that MBSRs reduce negative, repetitive thinking, and these other two researchers also found those same results in previous studies that they had conducted. So what is novel about this research? Basically, they wanted to determine whether or not MBSR was like a transdiagnostic way to intervene, because, they want a treatment that's versatile enough to cover the wide spectrum of anxiety disorders, seeing that, there's a lot of different site symptomology variances, and having this transdiagnostic format is really beneficial to know. So, yeah. All right. Additionally, while previous research indicated that MBSR could reduce anxiety, nobody had ever proven that MBSR could be effective for people who are diagnosed with anxiety disorders. So a lot of the previous studies were correlating anxiety reductions with patients with like chronic pain and other conditions, but not necessarily like diagnosed anxiety disorders. So one of the study's main strengths is the fact that they used a really wide range of assessment materials to cover all of the anxiety symptomology, and this made it to where it was clear to see like where anxiety went up, where worry went up, or worry went down, and depression indexes and the insomnia aspect. All of that was a lot of useful information. And so there were a few limitations of the study. Of course, there are always limitations. So the authors specifically cite that they would have preferred to look at an active control group for comparison, just to see if MBSR was better than what a treatment as usual would have been, maybe like CBT. However, they were just trying to take one step towards this goal, and they just want future research to incorporate this active control aspect. So additionally, they noted that a lack of resources prohibited diagnostic clinical interview at post-treatment and follow-up to measure changes in diagnostic status. So they did do these self-report assessments, but they did the clinical interview during baseline, but they wanted to do a post-treatment one and a follow-up one to see if there were any changes in diagnostic status. So they weren't able to do that because of money. And lastly, they wanted to video record sessions and then judge the method of instruction to ensure that there was protocol adherence throughout the entire study. But they weren't able to do that. So they say that, future studies should incorporate this assessment of protocol adherence. All right, and one of the things that is important for the paper that I actually ended up writing is this statement here. So the researchers also note that some participants who might not have benefited from MBSR might see more of an impact with MBCT as the intervention, since it involves a more therapeutic component in addition to mindfulness training. So MBCT is like the same as MBSR, except it kind of combines with just cognitive therapy aspects. So it's more focused on like how to relate with negative thinking rather than like how to deal with stressful thoughts. It's more generic and applied to depression relapse specifically for the most part. But yeah. Okay, so throughout this presentation, we talked about mindfulness-based interventions and how they're effective at reducing anxiety symptoms. Then we went into how this study specifically compared MBSR to a weightless control in patients with panic disorder and with or without agoraphobia, social anxiety disorder, and general anxiety disorder. And they found that MBSR decreases anxiety and depression scores on all of their self-report indexes that they measured. And so this means that there is more confidence in MBSR as treatment for anxiety disorders, but they do definitely highlight some of the limitations in this study and want more research in the future to further support this claim. Okay, so this is the official reference citation, and thank you for viewing. All right.